So now, before getting into our alumni introductions, I'll introduce our student moderator, Sumanbi, who is a third-year pre-med student, will be moderating the discussion today. So thank you, Sumanbi, for volunteering. And would you like to share a little bit more about yourself before we get into the alumni intros?
Yeah, for sure. So I'm Sumanbi. Nice to meet everyone. I'm a third-year student, as Cassie mentioned. I use she, her pronouns, and I'm studying global health and bio with a minor in sociology. And I'm just really excited to be here today to learn about these alumni stories and kind of understand what we can do as like pre-med students in the future. So yeah, thank you so much for being here. And thank you for the opportunity.
Great. Thanks, Sumanbi. And now we are going to get into our alumni introductions. And if you could share a little bit about what you studied in school and what you're doing today, and then we'll get to all of the in-between during the session. And we'll start with Mary.
Yeah, hi everyone. I'm Mary Doy. I'm a medical officer at the U.S. Food and Drug Administration. So I work in the Center for Drug Evaluation and Research, which is the D part of FDA. I analyze data. So I analyze clinical trial data in order to try to help make medicine safer for the US public. And more recently, I've been working in more data science projects. And so I've learned additional programming languages and I do a lot of data visualizations. I help make dashboards and also dabble in AI. So natural language processing techniques in order to process the data. So I graduated Northwestern undergrad in 1996 with a degree in chemistry and a concentration in biochemistry and was on the pre-med track. And I look forward to your questions and happy to be here.
I think we're on to Ben.
Oh. My name is Ben Lerner. I'm a vascular surgeon in Louisville, Kentucky, in private practice. I was Northwestern class of '97. My major was anthropology with a focus in archaeology. So until I had my medical degree, I told everyone who would listen that I was an archaeologist, which wasn't a complete lie. My practice as a vascular surgeon, we are the sort of caretakers of the surgical disease that doesn't involve the heart or the brain, but involves blood vessels. So I spend my day doing one of two things usually, which is either sewing together little blood vessels under a microscope, which is still one of the most amazing things in the world, or we have a pretty amazing acceleration in the use of technology and minimally invasive techniques to treat vascular disease. And that's sort of the geek in me that has always loved that and that part. I've developed an interest in practice in appropriate use for some of the therapies that we use. I'm an officer within my society, the Society for Vascular Surgery, and I sit on the CPT committee. So that's beyond the scope of what we talk about here, but that's one of the committees run as a joint process through the AMA and CMS, and we help develop how we describe the work we do and then how we utilize that. So that's sort of become my outside interest besides practice.
Hi, my name is Dan Shah. I'm an anesthesiologist, but I have some specialty training in chronic pain management. So I chose to spend 100% of my time focusing on chronic pain rather than doing operating room anesthesia. I practice here in Skokie, Illinois, so I'm right next to Evanston. So I've been here for about 2 years. So this is a practice that I started on my own. I'm an independent practitioner. So I treat chronic pain. It's all outpatient based, and then there's certain procedures I'll take to the hospital for minor surgeries and other procedures. Before this, I was working out in Indiana for 10 years, and prior to that, I spent some time as an assistant professor at University of Illinois at Chicago, where I trained.
Good morning, or I guess it's afternoon now. I'm Christine Ceslek. I am a practice pediatric emergency medicine at Lurie Children's Hospital located in Chicago, Illinois. I take care of patients both downtown at the tertiary, what we would call a tertiary care center, and also practice out in the suburbs, the western suburbs, at a Northwestern affiliated hospital called Central DuPage that has pretty robust community services for children. I guess recently, I've become pretty interested in child advocacy and issues related to supporting healthy initiatives, mental health issues with children in the emergency department, especially with COVID, the opioid crisis as it affects children, because that's not really discussed much, and just sort of reaching out to our legislative branch and trying to advocate for laws and funding for different initiatives to help keep kids safe, kind of more in the public health realm. And so that's been really exciting to sort of get out from just seeing patients and just taking care of patients to actually try to do something positive to impact on the future. And I find that that keeps me uplifted and still excited about what I'm doing, which is important and I think can't be overestimated to the students.
Awesome. Thank you all so much for the introductions. I think we can get started with the questions. This first question, I think all of you touched on a little bit, but I think the latter half of the question is something that I think students would love to hear about. So this one is about, can you tell us more about what you do today, along with some of the impactful classes or experiences for you in undergrad that led you to consider and also pursue medicine and or your chosen specialty? So I know you probably answered a little bit of the first part, but if you can more, I guess, expand on what kind of led you to pursue medicine and why that specific specialty. And we can go in the same order that we did introductions in. So Mary, if you would like to take it away.
Sure. I chose to do chemistry in undergrad. I was certain from day one that I was going to become a doctor. And so I was on the pre-med track as well. But I chose chemistry because I just love the quantitative nature of it. And I remember taking, Dr. Silverman, I don't know if he still teaches, but I know he probably donated a bunch of money. But I think he taught this medicinal chemistry class, and this is before his big drug discovery even. And so I remember just holding on to that, and I really enjoyed that class. And so that actually, it's interesting looking back. At that time, I didn't know that my career would end up at the FDA, but looking back, like some of those interests were there already in undergrad. And so, but I did go into medicine. And so I went to Washington University School of Medicine, and I pursued internal medicine because I found that that was very comprehensive and I really enjoyed that. And then I know that this is probably veering off the topic of the question, but I can tell you a little bit about my career path because I think that would be pertinent. And then so I pursued internal medicine, staying on at WashU, and then I went back to the Northwestern system. And so I worked at Northwestern Memorial Hospital as a hospitalist for 5 years. And then in doing so, I really enjoyed more the prevention aspect and the public health aspect. And then I went back to school. And so I went to get my public health degree in epidemiology. And so that kind of led me to data analysis here at the FDA, kind of joining, my medical background as well as my data analysis. But I think what I really enjoyed about Northwestern is that I think it did have some of those classes that weren't really, typically considered or maybe not even available in chemistry. And so it really just opened your eyes to a variety of fields.
Yeah, I arrived at Northwestern with the full intention of being a physician. I'm a fourth generation doctor. My great grandfather was an internist in Ukraine. My grandfather did house calls in Brooklyn. My father was a physician. I sort of always knew that was what I was going to do. And so the advice I always got from my father and from other friends of the family who were physicians was just study what you like. And so I took a very broad range my freshman year. I really enjoyed anthropology. What I really enjoyed about it, and hopefully it's still that same way, is as opposed to some of the more traditional sciences, even as a freshman, I could work with graduate students and work on graduate level projects, which was really, I really enjoyed it. And it culminated in a bunch of projects and really opened my mind to it. But that being said, my favorite classes that I still think of were Introduction to Russian Literature. And reading Dr. Appel and going through the American literature courses and still referencing that and still remembering that and that was such an influential part of my Northwestern experience. I think I can't stress enough how unique a place Northwestern is and certainly was for me, that my best friends turned out to be architects and actors and producers in Los Angeles, and not just a bunch of doctors that I, which is my current social circle. And I really sort of cherished the memories from that. I went to the University of Wisconsin after Northwestern, and then I ended up training in Wisconsin as well. The way I got into surgery is the way every surgeon does. The first operation you do, you just think it's the most amazing thing you've ever seen, and everything just sort of pales in comparison to it. So that's what I do, and still remember that almost every day now.
So for me, I majored in psychology, and it was kind of just a personal interest, understanding how the human mind works and understanding human behavior. I was already pre-med when I came to Northwestern, so I was pretty set on becoming a doctor, like the two previous people that just spoke. So I knew I'd have to take the pre-med courses, and it was a great, comprehensive program in terms of preparing for medical school. But I wanted to kind of get a non-science aspect education through the College of Liberal Arts and Sciences. So I chose psychology. It interested me. And in terms of nowadays with my practice, I deal with a lot of chronic pain patients who have a lot of psychiatric issues, social issues. So, a lot of the coursework that I've done and research I've done, it's really helped in terms of addressing these people and establishing rapport with them and trying to treat their chronic pain, because they tend to have a lot of concurrent morbidities, like comorbidities, like anxiety, depression, mood disorders, and even addiction. So it's been good in terms of preparing me for this specialty. Originally, I never knew much about pain medicine. I just was interested in anesthesiology during medical school. And so when I experienced, you do rotations during the residency. And so when I experienced pain management, I found that it was a good fit for what I was interested in. I really enjoyed pharmacology, physiology, and also treating chronic pain. And most of the pain that I treat is spine related. So that was very interesting to me as well. So, as an undergrad, going back being an undergrad, I just really thought Northwestern was great. There was a lot of different people that I met. In terms of networking, there was great diversity and a lot of opportunities. So I kind of was able to work with different programs, volunteering with like respite care, which was, I was working with a special needs child. So I was able to do that. And then there was plenty of research opportunities while I was there. So very grateful for my time at Northwestern.
I have to follow that up with saying that I chose psychology as well as my major. I did come to Northwestern fully intending to go to medical school and being a doctor. No doctors in my family, so I'm really not sure exactly why I chose that, but I just sort of always knew that that was something that I thought I would like to do. I think initially I thought I would be a biology major and took courses in that direction, but then realized maybe as a junior that I wanted something a little bit more broad. Like what if medical school didn't work out, or what if I changed my mind? I didn't think that I wanted to teach biology or do research. And so I felt like this was a good plan B just in case it didn't work out. And I think it put my mind at rest, that I wasn't putting all my eggs in one basket, and I could relax a little more and just kind of enjoy the process. So for me, that was a great decision. I also find that I use the skills that I gained in some of my classes every single day. So as an ER person who works with children as well as parents, my job is to observe human behavior, kind of pick up on those cues that maybe aren't verbalized, and also to get people on board with understanding what I think is going on and how they can best help their children. So kind of reading the room when you first walk in, and seeing, how is their personality? How do they interact with their kids? What's the best strategy that I can use to do my job best? And I found that I use a lot of those skills that I picked up in classes and just having an open mind. So for me, I enjoyed my chemistry classes very much, but maybe not physics as much in some of the other classes that were more engineering related. So I knew that I could probably handle the amount of information that I needed to learn in medical school, but that taking care of patients was probably where my interest lied rather than a rote like scientific route. And I was pretty comfortable with that. I really enjoyed some of the classes at Northwestern where we had small groups. I think they were called seminars, if I remember, because it gave me a chance to really get to know people outside, again, of a pre-med track. And I found it was really nice. We had a really good group for some of these classes that we became friends. And again, it's really nice to have people who have different interests than you do, or maybe pursuing a different course of study to kind of balance out your life. And I think Northwestern does that very well. It's a smaller school, so we're able to actually get to know people more intimately. I don't know if other colleges offer seminars or if they still do, but I found that that was really a unique opportunity in college that I enjoyed very much. So kind of similar to what everyone else has said, having that broad College of Arts and Science opportunity. You could take sociology classes. I learned a little bit about economics, which hopefully helps me. And I really wish I could go back and do even more classes that I didn't have time to do then, because of course our interests grow as hopefully we mature.
Thank you all so much. I think it's so encouraging for like pre-med students to hear that, it's important to take different classes and really explore different fields, even as like people that want to go into medicine. I think all of those different fields of study really help you become a better doctor, honestly. So I think, thank you so much for sharing that. So we can move on to the next question. This one has to do a little bit about gap years, and I'm sure a lot of students would love to hear a little bit about that. So did you go to medical school right after undergrad? If not, did you have any impactful experiences between undergrad and medical school? And also any advice for students hoping to go like straight through or also hoping to take time in between? So if you can speak a little bit about your experiences, that'd be really great.
Yeah, I took a gap year. Again. I took a gap year. So I took a year in between undergrad and medical school. I applied, during the regular time, and I deferred. So I was fortunate. So so my medical school allowed me to defer. And what I did was I spent a year in Japan, so on the JET program, so the Japanese Exchange and Teaching Program, and it was so wonderful. I can't lie. I mean, undergraduate years are pretty intense, in terms of getting everything done and, getting the grades you want in order to get into medical school. So I just really needed a year to kind of decompress. So mainly it was to decompress, but also, I mean, my heritage is Japanese, and so to get to know my relatives more. And I was able to teach. I really wanted to teach. So I think that is such a valuable lesson in everything I've done since then. So we're always teaching patients. I've taught patients in terms of their disease and their treatment regimen. I've taught medical students, residents, and here at the FDA, I've taught a lot of courses for intro to review, how to review and application courses and how to review analytical tools. And so, so that it was just valuable all around, and it was perfect for me to take that gap year. And so if you have any, so I think you can do it in a number of ways. So I think that's really important to know. You can actually, medical schools allowed at that time, because it's 20 years ago, allowed to defer at least my medical school. And I believe that that's pretty common at that time even. So you can do that, or, defer or apply later. So there's just multiple ways of doing it, but I would highly encourage you to do it, because it's really hard to do that after medical school or in between med school and residency. There's really not too much of a time. And then when you have a job, there's a lot of responsibility there too. So I would highly encourage it.
Yeah, that's an excellent point, Dr. Doi. I took a gap year also. I deferred. I would, and it's good to understand that distinction as well. Deferral meant I applied in the traditional way that the rest of my classmates did. I received an acceptance from Wisconsin and then just told them I'll see you next year, and they were fine with that. And that that was very common. Many of my classmates did. I'm not sure if that remains common. I cannot emphasize that enough. You will not get that chance again. And so I will in a little secret that I didn't know when I graduated from Northwestern, I thought undergrad was much harder than medical school. And I was just tired. And I had so many projects and so many things that led right up until the day I graduated. And I just wasn't ready to start it again. I probably could have. Medical school is designed to let you succeed. That's how I've always felt. And Wisconsin was great about that. And you were very sort of nurtured. But I was tired. And I think the other thing, I've sort of been polling my partners and other people, you know, what would you tell medical or students who are applying to medical school? I worked at Quartet Copies, which I think is still there on by the old Buffalo Wings place. And then two of my roommates from Northwestern had started a production company in Los Angeles. So then I went out there for a couple months. I actually worked at Barney's, which was a really high-end clothing store. I sold Ben Affleck a suit once. So it was sort of bizarre to go back and think about these things. But one of the things that keeps coming up when we would, what would you tell students applying? It's that we never thought about the cost of medical school. And I was actually able to pay my whole first year of medical school. Now, this is a public medical school, but I earned enough money in my gap year to pay off my first year of medical school, which I don't know if you could do that again. I don't know if that's possible anymore, but the repercussions, I mean, I'm still paying off my student loans, but they're significantly less because of that year. But just mentally, I was better prepared, I think, to go in, and I was ready to start studying again. I think that it really was important for me and my sanity to approach. I'd waited my whole life to get to medical school. That was the goal of every decision I'd made up to that point, and I just wanted to be in the right space psychologically for it, and so that was very important to me.
So in my case, it's a little different than Dr. Doi and Dr. Lerner. For me, I actually, when I went to Northwestern, I finished in 3 years because I had enough AP credit, and at that time they had allowed students to apply the credit. I don't know if they still do. So I was able to finish 1 year early. So it was kind of very hectic those 3 years trying to take all the pre-med courses, my major courses, and then study for the MCAT. But I was somehow able to do it. And then, so I immediately applied to medical school because it's the only thing that I knew that I wanted to do. So I applied early decision to University of Illinois, Chicago. So I found out at the beginning of my senior year, which was my third year, that I got in. And so I chose not to defer because at that time, I didn't see the point. But, you know, looking back now, if I could change things, I would probably want to spend more time. You know, there was no reason to rush because once you, like Dr. Doi said, once you get to medical school, there's really not too much time to take time off or take a break. So it's something that, you know, I would strongly recommend if it's an option for potential students that are interested in medical school to take that time off or take a gap year, do whatever you're interested in, do research. But it's definitely, there's a lot of students that do burn out when they get to medical school because it is pretty intense there. It's in a little different way than undergrad. So I think, yeah, I would recommend the gap year if possible.
I too went straight through applying to medical school while at Northwestern. Got accepted to University of Illinois as well, and decided to just go forward. I think in my mind at that time, I wasn't really considering other options. I was kind of focused, maybe a little bit too much, and maybe not having the insight to know at this time that this is your one and only chance to do something else. Like I would almost want to take a gap year right now, right? And I do think about that sometimes. Like I wish that I would have maybe looked around a little more and had a chance to experience some other things before I went to medical school. I mean, I have to say, honestly, probably the first round of tests that I took that first year, I realized, wow, I'm tired. And I really didn't take any time off, and summer was too quick. And I remember having that moment, like, is this what I really want to do for the rest of my life? This is hard. This is really pushing. And I think I was reading like a pathology book and looking at disgusting pictures and eating at the same time. And I thought, well, if I can do this, then I'm meant to be a doctor because this doesn't bother me at all. And I was able to push through those tests and do fine. But I do think about it now, and I agree that if it's something that you're entertaining doing, then you should for sure take that gap year. But do something with it and really enjoy it, and use it as an opportunity to reach out and, you know, like kind of grow as a person, because that's something that we should be doing all the time. So I'm not saying that you have to take a gap year, because the two of us did it without a gap year, and we were a year ahead. But being able to have a bigger perspective of it and realizing a year is nothing in your life, and you do need to sometimes consider other options. So if you have a good opportunity with something to do for your gap year, or you're feeling that that's what you want to do, you shouldn't feel that it's wasted time. Absolutely not. But if you're feeling like you want to go through and do it, then that's what you should do. So you have to follow your heart and what your mind tells you, and how you feel the best decision is for you.
Thank you so much. That's, I think, so helpful for so many students, especially people who are like considering both options and stuff. So thank you so much for your thoughts and your ideas on that. And we're going to shift gears a little bit, but the next question is, what advice do you have for networking or shadowing within your specialty, particularly now that we are all connected virtually, and then also like any other ways that your work and or industry have shifted due to the current global health crises, that you like to share with students who might pursue similar careers in the next year or two. I know it's a little bit of a loaded question, but let me know if you'd like me to repeat it or anything like that. But Dr. Doi, if you could get it started, that'd be amazing.
The FDA has a lot of fellowship opportunities, and so I do want to point that out. And so that's just a way of pretty much seeing what is, I think that there is an AMA fellowship. Those are opportunities where you can kind of get a taste of what we do here at the FDA, and get a taste more of public health. So I think nowadays it's easier. So we, at the FDA, we've been working from home actually. So in the middle of March, they actually sent us to work from home. And so I've been working here out of my home in Fairfax, Virginia for this whole year. And so that's how we've shifted, and they've responded very quickly in order to get us working remotely, and they were able to get the IT infrastructure in place. I mean, up until then, I mean, we actually were working from home like a couple of days a week. And so we've had that flexibility. And so it wasn't too much of a bigger lift in terms of getting all of us to work at home 100%. And so that's how we've shifted. But in terms of the work, I mean, it's basically, I work longer hours now that I work from home, right? So I think we've generally become more productive as we've worked from home, but it's still the same mission. I think even stronger now with the global health crisis is that we're more kind of fine-tuned to how our work impacts public health.
Yeah, this is when I saw this question, it was very interesting because, obviously, I mean, as a surgeon, it is very difficult to network remotely with what we do. It's still very hands-on. However, meetings and department meetings, and depending on where you end up or what your relationships are, most of these meetings have gone remote. And so we used to have these sort of hallowed Tuesday morning meetings where we talk about patients, and that used to be face-to-face, and now it's remote. You can log in from anywhere. And so there really is a pretty remarkable opportunity, I would think, for people who want to try and engage with a department or a particular professor or physician as far as networking, that you could actually do it remotely. And so that, it sort of depends on your interest and what you're doing. For us, particularly in vascular, COVID really didn't stop a whole lot. There was a lot of the elective things obviously fell away, but COVID itself was it's what we would call prothrombic. So there's a lot of clot related complications with COVID. And so we were almost just as busy throughout the whole thing, which was scary for the beginning of it. And so we, the only thing I had to be thankful for COVID is my life felt normal from a work standpoint, because I still went in, I still saw patients, I still operated almost every day. That we had a schedule because there were things to do. Patients tended to be sicker and a little different, and so that changed it. But for us, we, if something is bleeding, it needs to stop, and that's when we get called. And so that's sort of what my COVID experience was like.
In my specialty, when the pandemic started last March, things kind of changed for me, because before that happened, Medicare, commercial insurance, they never really allowed for any type of telemedicine. It wasn't really reimbursed. So everything was in person. And also it's important to see a patient in person because you kind of have to rely on a physical exam to make a diagnosis and for treatment. But when the pandemic hit, it was a little different. They really emphasized trying to increase patient safety. And so minimizing interactions. So they allowed for telemedicine. It was kind of like an emergency order from the government. So they allowed to count like a regular office follow-up visit as through like Zoom or a different type of audiovisual interface. So that was really different. So it's kind of trying to get adjusted to seeing a patient that way, managing their medications or ordering different types of procedures or tests remotely. It's a little different than what we're used to. It's not something that we're trained with in medical school because this is a completely new situation for us. So it was kind of a year of becoming acquainted with how to use Zoom, or I use something called Doximity, but it was a good experience. It helped me refine the way I manage patients. I think in terms of networking, I think for students that are interested, I think sometimes it's easy if you kind of reach out to primary care physicians. A lot of times they're independent. They tend to be willing to let students like even shadow them or just kind of watch what they do. I have a private practice here in Skokie. It's not too far from Northwestern, so I'd be happy if any students were interested in spending time here. It gets a little trickier when you try to shadow in a hospital because they tend to have more restrictions on people who are not affiliated with the hospital or who don't have privileges. So a lot of times it's hard for a college student to spend time. Other things that you could do is maybe even try to get research opportunities. A lot of the like different specialties in medicine, they have research departments that, I think would welcome college students so they can become more familiarized with the research that's kind of the backbone of the specialties that we were all involved in.
I would definitely agree with the transition to telemedicine. Although practicing emergency medicine, my days weren't any different than they were before, other than, a lot more PPE and concerned people about COVID in general. But we still were there seeing patients. And as far as our workflow, it didn't really change other than just having to take additional precautions. Telemedicine was really, really adopted by most of the private practices in our area. So we found that we were, filling the gap for people that could not be seen in person. And also taking telemedicine calls for outside emergency departments who were taking care of kids to try to see if we could prevent having to transport some patients who we could give some advice and adjust their care. And then they could go home, really trying to keep people out of the hospital, out of the inpatient setting, out of having to come to another emergency department. So I definitely got some experience with that. For me, practicing in an academic center as well, we do have a lot of departmental meetings and educational sessions, and all of those are done remotely, which for us in the ER has been a blessing because with our crazy schedule, it's often difficult, to drive to the hospital to meet in person after you got home at 3 in the morning and you have a 7 o'clock meeting. And, for us, sleep is definitely something that in the ER, you have to be able to push through and not sleep. That goes without saying if you choose that field. So it's been great because it's allowed people to participate in a more complete way. And for me, I have 2 children at home. I could be with them more often because I'm not spending an hour driving to and from the hospital for an hour meeting or a 2-hour meeting that I can, tune into now. So for us, I think it's been more inclusive. It's been more enjoyable. I think the platforms have improved. We're away from the call in for a meeting where you may or may not be able to hear the person who's speaking. Now I think that the video is good. You can interact. People understand the culture a lot more. And so, there may be an opportunity. I haven't really thought about that, but having listened to what everyone's saying, there may be an opportunity for students to, participate with some of that interaction. I'm not sure how you get approval to maybe listen in on cases or patient presentations. I don't know that we're there yet, but certainly something that we could consider in the future. I know I've had a lot of students with me in the ER in the past but we're not allowed to do that now because of COVID and the restrictions. So, and I have asked, and that's not going to change for this summer, unfortunately. So that's something that I really do enjoy, having people there and just kind of run around and interact with all the residents and the fellows, and just kind of get an experience of what it's like to practice in the ER. What's a typical day? What do you see? How does it actually work? Is it anything like you see on TV? Which is a lot different, and things don't happen as quickly as you would like to sometimes. But I think going forward in the future, there'll be opportunity in person for people to come and, you know, shadow all of us, to be honest, depending on where you live, right? If you're a little far away there for people, but somebody might be there in the summertime. But I do think trying to just think outside the box and take advantage of any opportunities that present themselves, at least remotely for now, and then be prepared when we do switch to in person. So it's not a bad idea to have some things set up that maybe you can transition to in the future. Of course, it's all going to be dependent on how the pandemic plays out, but it never hurts to put yourself in a good position to have success going forward. So thinking ahead of time is really important, and planning these things out and having a plan A, B, and C just in case, because that's what we all have to do these days.
Thank you so much for sharing. I think that's also super helpful to hear, you know, what's going on right now with the field, and also opportunities for students to kind of pursue moving forward. And we have time for one last question, and this is my favorite question. But what do you wish you could tell yourself when you were in these students' shoes? And then Dr. Doi, if you could get us started.
Sure. I mean, I think, you know, public health is, I guess, still considered like an alternative, you know, medical career. You know, at that time I went through, and it was basically everyone. So I'm the only one out of my whole entire class from medical school not practicing clinical medicine. So I think back then, just knowing, you know, pursuing something different, but it still aligns with taking care of patients, but more broadly and on a population level. So just know what interests you, and try to find mentors who have those interests as well. So when I went to pursue my public health degree, that's when I finally saw people with MDs and NPHs, you know, working in a different level or area. And so, but just stick to your guns in terms of what you're interested in. There's something out there, you know, for you.
Yeah, I actually used to, my first job was at the University of Washington in Seattle, and I used to give this talk to medical students, and I sort of stole it from a graduation talk I heard once, that, you know, especially in medicine, you think of your career path as really straightforward or black and white. It's all set for you, but you got to leave gaps and leave gray spaces in that black and white, because medicine, you know, I graduated medical school in 2002. And I entered my practice in 2010. And my field, even in the 10 years I've been here, has changed dramatically. Just with technology, COVID is an excellent example of how we've all had to adapt. And if you don't have that ability to adapt in something like medicine, where we need to be the ones who are thinking and the ones who are flexible, and because our patients expect that of us, it's going to be a struggle. And so to leave those in your own career for things that you may find interesting, the way your career path may change. And you need to have the flexibility for that. And so I've always pictured that as the gray spaces in the black and white. And so it's something to sort of think about. If you're wired the way most pre-medical students and medical students and doctors are, we don't have a lot of gray spaces. It's very black and white. But you have to force yourself to, and every once in a while, it will really lead to an amazing opportunity.
For myself, I feel like if I look back, I felt like I mentioned before that I'd rushed through things, and I was just very focused on just getting through medical school, and I kind of stopped looking around and enjoying things around me. So I stopped doing pursuing other hobbies or interests, and so it started becoming what defined me, being a doctor. And I did, you know, that's not really something that you want as being your 100% definition of who you are. So I would recommend to myself to pursue other interests, take your time, and just, you know, don't rush into things.
I agree with what everyone has mentioned so far. And I guess I would say, don't put too much pressure on yourself, because being a Northwestern student, you know that you have the ability to do what you need to do and to learn what you need to learn. I think Northwestern prepares you in an excellent manner to handle the rigors of medical school and life in general. Again, you know, I definitely was someone who didn't look around as much as maybe some of the other panelists. And you know, if someone could have told me that at the time, maybe I would have looked around a little bit more. But it turned out okay too. And you know, all of our paths are a little bit different. But if you notice, like all of us are doing different things, and we're considering different pivots, because that's what keeps life exciting, and that's what keeps you wanting to come back. If this pandemic hasn't taught us all what a great profession it is to care for people. I mean, it was really life and death. And, you know, for a while we were all called heroes, and, you know, people brought us food every day for at least 2 months. And that was fantastic because you definitely felt appreciated, which you don't always as a physician, believe it or not. But, you know, learning again about something new, and it's so important to stay up to date and be able to provide what your patients need and keep your own personal sanity. You know, if that wasn't a lesson for us, that what we're doing is such important work, and that you feel it in your heart every day. Like, I made the right decision. I know there are difficult days, but I wouldn't want to be doing anything else. And I think most of us, you know, you need that reminder every once in a while throughout your career, because it could become very stagnant and rote. And medicine and life should never be that way. So while the pandemic presented many challenges, I think for us, it just reaffirmed that we made the right choice, and that, you know, the struggles that we went through were worth it, because look at what we get to do, and look at how we get to impact the world. And, you know, for me now wanting to do advocacy, it's just a logical extension. Maybe the pandemic pushed me more in that direction, as well as I saw, you know, there's more than just medicine. There's a lot of other things that one could do that really can impact. And, you know, even at my age, we're allowed to have new interests, and, you know, you can always learn. I'm actually thinking maybe of possibly going back and getting a degree, like an MPH or MS or something. But every day that I think about it, I also think, well, that's a lot of work, and I don't know that I want to do that. How am I going to use it? But it's important to remember, you're not set in your career. And the synergy that we've seen develop between different type of professions with medicine and engineering and the testing and the pharmaceuticals and now public health and our government and everything coming together for a cause. You know, it does show us that medicine is at the center of a lot of things, and you don't have to limit yourself. Again, just seeing patients is a fantastic thing, but there are so many other things that you can do, especially if you find that you need a little bit of a change in your career.
That was beautiful. Thank you all so much for your time and for sharing your experiences. I think it really means a lot, like, to me, and also all the students that are on this call right now. It's just really inspirational to kind of learn from all of you. So thank you so much. And I'll pass it on to Cassie, who will be taking student questions.
Great. Thanks so much, Samanvi, for moderating and asking those questions from the student perspective. And our first question for our alumni is how you dealt with burnout throughout your career. And I'm curious if you can share a little bit, you know, of how you dealt with it when you were close to these students' shoes, and then also maybe how that's evolved further in your career to how you dealt with it when you were, you know, after medical school in a career. So Mary, we'll get started with you.
With burnout. So when I was in internal medicine hospitals at Northwestern, that was tough. I think after a couple of years, you know, I felt like it was getting harder and harder. And so at that time, I guess it helped me though, because at that time I'm like, okay, so it helped me reevaluate. So after about 3 or 4 years, and that point where I was feeling like I was burned out, like, okay, do I want to do this? You know, how long do I want to do this? Can I do this for a lot longer? What did I originally want to do? What are some of my other kind of passions? And so I think I used it as kind of a thing that spurred me forward. And so when I did feel burnt out, I reevaluated, and that's when I applied to go back to school. So And then I went to UIC School of Public Health and entered epidemiology and got a degree there. So I think, you know, when you do burn out, you just have to make a change, you know, whether it's in your, you know, the structure of your workday or your work environment or a different career. And so for me, it was actually a different career because I'm like, I'm not on exactly what I want to do. I want to focus more on prevention and population health. And so it just spurred me on. So I find it as a good barometer of how things are going.
Yeah, it's a great question. It's a word I probably didn't even hear until I was a resident, and certainly wasn't thinking about. My wife is also a surgeon, and so and if you pursue a career in medicine, you often will find a partner who also is in medicine as well. And so it's not just your burnout, but it's your partner's burnout, and so those are things to think about. The way I dealt with burnout was I left my job. So I was in an academic job, which I loved in the beginning. I loved Seattle. I loved where I was. But eventually the job became something I just wasn't really happy with. And so that's when we moved not only location, but entered private practice. And so it gave me a significant amount more control over my time. At that time, we'd had our first child, and so that was really important. And so just reclaiming some of that helped with my feeling of burnout. And then the partnership I entered in my new position here is just, it's a supportive group around you. And so it's probably a long-winded answer for there's burnout related to the job itself. And if that's something, you know, and there's a lot of indicators for that. But that's something that you're going to have to figure out whether you want to continue that actual job. But then there's the demands of being a physician and call and time away from family and people you care about. And that's never going to go away. And as long as you're a doctor. And so that depends on your support system and the people around you understanding that and being able to sort of support you with that, because that's and you never want to be too negative in a form like this of the younger generation, but that's something that won't go away. I mean, we are, by our nature, we're going to be called away from important things in our lives, and it will be upsetting to the people around you, and so you have to find a way to deal with that.
I think during medical school, it can be pretty stressful because it's a new environment, and then the workload's pretty intense. And then as you progress, it changes from more like academics to more time spent doing clinical rotations, and you start taking call, which is new. And that's something that can be stressful for people, where they spend like 36 hours at a hospital. I think there's new limits in terms of how much time a student spends, but it can be overwhelming, you know. And then on top of that, you're a medical student, then you're accruing all this debt. You know, I'm hearing stories of students now finishing with like $500,000 worth of debt of medical school because it gets so expensive. I finished, I think I was like 100 to 150,000 in debt, but it's stressful having that financial burden, and you're not even working yet. So this is all accruing, and you consider it as an investment in your future, but it's just not a good feeling when you finish and you start working, you have to start paying this debt down. So it's stressful. You know, I think things to try to deal with it's important to have very good a social support network. You know, your medical student friends, you know, they're very helpful because they're experiencing it too. Building up those friendships is important. And then family is very important as well. For me also, now that I've been practicing for about 15 years, I was working as an employed physician for a while. So that was a little stressful for me because I felt like I didn't have as much autonomy. I was kind of it was almost being, the private practice I worked for before was almost being run like a business. So it was not the kind of way I wanted to practice medicine. So there was just I wasn't really happy. So at that point, about 2 years ago, I decided to just leave and just open up a practice. And also my wife wanted to come back to this area where we're originally from. So, so yeah, just like stated before, you know, if, you know, you don't have to deal with burnout, you know, just make a change, you know, look for ways to change your situation, your environment. Yeah, you don't have to just keep on suffering or get pummeled. It's something that you can actively look for things to make your situation better. But again, it's something to consider if in a career in medicine. There's a lot of hardship. The reward is great at the end, but there is a lot of hardship. But there is always a light at the end of the tunnel.
I don't know that I can add too much more to the dialogue, but I agree. I think burnout is going to happen, and you should know that. And being able to recognize that it doesn't mean you're weak, or it doesn't mean that you can't handle the work. It doesn't mean that you're not a good doctor and not good at what you do, but it's sort of inevitable. There's a lot of work and a lot of responsibility for sure. And like everyone else said, just try to recognize it's coming and realize you don't have to continue in that present environment. You have to figure out a way. If it's taking a few days off and like regrouping and trying to figure out, is this what I still want to do? How can I adjust things a little bit? And just making it, I think having a sense of some control is really important. And I think we've all kind of said that, feeling like you can pilot your own plane, and that you're not stuck. In pre-med, you kind of are stuck because you have to take the classes that you have to take. We don't have a lot of choices. But when you're an adult and you have a profession, you can choose. And so you should never feel that you don't have choices, because there are always choices. It may not be obvious to you, but just remember that you control that part of your life at least. And you can make those decisions and you can make active changes. And that's okay. It doesn't mean that you're weak, like I said, or incapable.
Yeah, absolutely. Thank you all for sharing. And we have a few more questions, and hopefully we can get to them before the time is up. And of course, students, if we don't get to your question, we're just sharing contact information out after, so you can stay connected and get those questions answered. But this next question is for Dr. Doi. And as I ask this, I'm curious, if our other doctors have feedback on, intersecting industries and whatnot. But this question is, are there possible career paths where physicians practice clinical medicine and work with data science, public health simultaneously? What are some other careers similar to your work at FDA where data science is implemented in a medical setting?
Yeah, there's a lot actually. So that's a great question. So industry, so private industry, so pharmaceutical companies, they're doing a lot. They actually analyze the data and they submit those analyses to the FDA along with the data sets. And so there's private institutes of pharmaceutical companies. So the public health environment, so there's the federal level. So there's the Department of Health and Human Services, which incorporates like CDC, NIH, FDA, CMS. And so those are the main agencies in public health. Additionally, there's city and state public health departments. And so there's a lot of epidemiologists, clinical epidemiologists. And there's also, so those are the main kind of fields. And this is everything I looked into when I was applying as well. And there's a lot, and again, at the time when I was applying, there were a lot of fellowships too. I don't know how COVID kind of changes those fellowships. Like CDC has like an epidemic intelligence service. And so those are clinical epidemiologists. So people who analyze data with a clinical background. And then there's a lot of this, I heard, so I recently was talking to someone from the West Coast had graduated, and then there's a lot of startups there too. So there's consulting firms, there's startup companies, Amazon, they're getting involved with a lot of like clinical applications in terms of the intersection with data science and clinical medicine. Of course, like even Apple Watches these days, right? So they're incorporating a lot of kind of digital health. So there's just a lot of opportunities, as well as in the hospitals. There are clinical epidemiologists, and then there are people who help do clinical informatics, and so each EHR systems and everything like that. So there's really the field is huge.
I think embedded in that question is a great question, which is sort of about plan Bs. And you think about plan B when you're a medical student, what if you don't get in? But I don't know very many physicians, and granted my circle is mostly surgeons who don't have a plan B. We worry about it constantly because physically we have to be able to do our job. If we can't physically stand for 5 hours and not have a tremor and not have neck ache, we can't operate. And many people do. And so then you have to figure out what is the next step. And I think that it's always reassuring to look at your colleagues, because we're these incredibly smart people who would have been very good at doing a lot of other things, and we happen to find medicine. And there is so many things you can do with that training and that level of dedication, and the same impulses that brought you to help people that you can bring into many other industries that are welcome and really very good tools for survival. And so just because you have more than one interest, but you choose medicine doesn't mean that your other interests ever take aside. If I hadn't been a doctor, I would have tried to be a novelist. And instead what I do is I write what are called CPT codes, which it's something if you go into medicine, you'll learn all about. But I'm one of our advisors, and we spend all these times on words and punctuation and how do you phrase a code and description of work. And I still remember my composition classes. It's just like that. That's, you know, these things carry over from our skill sets.
Yeah, that's really helpful. Thanks, Ben, for the follow-up, and Mary for a number of examples for the student. And I know we're approaching 1 o'clock, so I want to ask one last question of you all. And this is a really interesting one to end on. A student asked, have there been times in medical school or afterwards when you experienced failure or setbacks, and how did you deal with that? So Mary, we'll start with you to close it out.
You know, in terms of failure or setback, I think my career transition, I think that actually, I didn't see too many people doing that same career transition. And so I think it was difficult for me to be able to go on that path because it was breaking away from the norm. And so that was challenging, but then actually it was just rewarding because I was able to kind of forge my own path, and then found out, you know, that later there's actually a lot of people on this path. So for example, at the FDA, there are 800 physicians, so sometimes larger than some academic institutions. So anyways, I think you may feel alone, but once you go on the path that is really yours and you feel very committed to it, you'll find out that you're not alone. You'll find a lot of people interested in the same things you are.
In surgery, you are confronted with failure on a regular basis. And I did part of my training in the UK, and the subspecialty training there it's much more of an apprenticeship. You kind of have one person you work with. And I remember my favorite consultant, we would sit down after every case, every operation, and say, you know, what was memorable, what was good, what would you do better? And I've sort of stopped doing it at some point, but I used to do that for every case. And you think about how you could have improved, even the ones that went well. But certainly it makes you much more introspective, the ones that don't. And so it's a constant sort of quality control within your own practice and quality assurance. But make no mistake, I mean, to practice medicine is going to be to fail at some point, and some failures are devastating, and some people don't get over them. We deal with the most intimate things in people's lives, and sometimes they don't go well. And there's no way to prepare for that. There's no way to train for that. It's about being well trained and trusting the people who train you, and just knowing that in the greater scorecard of these things, you're going to come out ahead much further than you're going to come out behind, and it's still the best job in the world.
In my practice or in my specialty, it's chronic pain. There's a lot of patients who have been treated with surgery or with other medications, but just haven't gotten better. So it's something that I'm used to seeing. So for the most part, I'm able to help these patients through different types of injections or procedures, but there's always that patient or subpopulation that just never gets better. But I think, you know, it's something that I do get used to. It doesn't really discourage me. I think there's a lot more reward in it because there's other patients who do quite well and really are much better after being treated. So I think there's a trade-off. So I think there's no way we can fix everything in our environment or with the patients that we treat. But, you know, I think the positive impact is what really motivates us to keep on working and keep on going at it.
And I guess I can share a failure that's very close to where you students are right now. And that was my first test in my physics class, fall semester, which did not go well. And I remember going to speak to I don't know if it was the PA or the professor themselves. And, you know, basically that person didn't give any credit for any of the questions. You either got it right or not. There was no partial credit. And so it ended up, there weren't that many questions on the exam, and it wasn't a good grade. And I remember thinking, well, am I going to even pass this class? I mean, with such a poor performance to start out with, and kind of it almost psychs you out that you're going to be able to do okay. Can you handle these things? And physics is still not a great field for me, and I would never choose to do it. My mind just doesn't work that way. But I remember having that moment, like, is this going to be something that keeps me from doing what I want to do? Because this is just not something that comes easy to me. And, you know, you need to just push through and get through it. And there's going to be things in life that you just get through. It doesn't mean you have to be perfect at everything that you do, but you have to do well enough. And it's okay that you don't get perfect grades, because there's going to be, you know, something that's a little bit more difficult for you, and just accept it and do your best and know that you're just like the rest of us. Everybody has something that they're not great at, and you're not going to get A's and feel confident in every one of your classes. But just try to really do good at the ones that you like and that you're good at, and then you'll overcome the ones that are a little bit more challenging.
Yeah, this is all really helpful advice and stories. This has been great hearing from all of you. And students on the call, normally we buy you guys lunch during these programs, so we'll be sending you all a Grubhub credit, so keep an eye out for information from me on that. But join me in thanking our alumni for being here today. Thank you so much for sharing your advice and insights. Mundi, thank you for moderating. We hope you all have a great rest of your day, and go Cats.
Thank you.
Thank you.
Thank you.